is doing right here. The left side is a injury recovery and rehab taping. It's a tear in a muscle. That's the peroneus tertius muscle. That horse has a tear. That taping is to help that. And on the right side is a taping for a horse that has swelling, and we'll go over that. So I said that the tissue decompresses the tissue and increases circulation, and how important is that? Well, you can't really see it on the horse because the horse has hair, but you can see it on a person. So if you look at this picture, all the way on the left, this particular girl fell at WEF. She had a very bad fall, was taken out by helicopter, but they called me to tape, and you can see there's a horrible bruise. If you look at the second picture, you can see on the top of it, that's where the tape was. The third picture, you can see more, as the tape got rid of more of the bruise, and in the fourth picture, how it got rid of all of the bruise. This is in 4 weeks. So we really know, those of you who've been injured and have a bruise from a fall, you know how long it really takes, and it takes a long time. But this is 4 weeks, and the reason it works, again, the science behind the tape, is it decompresses the tissue, it increases circulation, it moves blood and stasis out of the area, it moves lymph, it moves the toxins that are in there out of the area, and it helps heal. And also, it also brings new blood, which brings oxygen, which helps muscles work. This is a horse that had lymphangitis. Now it has lymphedema. The difference is the septic quality of it. So now we have a horse that has lymphedema. This was actually only over about 4 days that this occurred. The left, obviously, has no tape, and then the one in the middle, there is the taping. You can see how big the leg was, again, from the swelling. And then that was about the next day. And the taping, the last taping, and the next to last taping on the left was the same taping, just that was the day after that. So normally we have so much problems when we have horses that have lymphedema, trying to get rid of them. We poultice, correct? We wrap, we bandage at night, we walk them around. Because the tape increases circulation and gets rid of the inflammation, it can pull that out really quickly, and you can see the effect of it. It's great for that. It works fabulous for that. So the benefits of equitaping, one, of course, as I said, it does decrease the inflammation and give support. This first fetlock support, that's a common taping. A lot of polo ponies use that. They actually play their matches in that taping. It gives a lot of support for the fetlock. If you look at the taping in the middle, there's also biomechanical tapings. That means it changes the function of the movement or the function of the way a joint acts. So in a suspensory desmitis, the picture on the left, you can see that there's not a lot of support for the suspensory. But with the tape, there is. And so we can use it to help horses balance, to help heal, to give support to joints that where the ligaments aren't able to support it. And we know how important balance is for horses. We also know how many conditions come from overloading, offloading, overuse syndrome. We can help with that. And a hock support, that's obviously a common one for jumpers. Many horses have problems with muscles. And I just mentioned overuse syndrome. And I think that's a very, very common problem that horses have. As the speakers before me, Dr. Addison and Dr. Matt mentioned, chronic conditions where there's a chronic insult to an area that you overuse or you use incorrectly over a while starts to become damaged. So we want to try to help that, and the tape can easily do that. The gluteal taping on the left, that girl also has tape on her arm as well. So the rider and the horse are taped, and the rider and the horse combination is really what makes performance successful, as we know.